go. Okay guys, Dr. Barrett here. What is up, you guys? We're going live. We are live. We're live here in Beverly Hills. Okay, so for those of you that are joining us right now, we are, as promised, we're going to talk about some Brazilian butt lift myths or buttock augmentation myths that you may or may not know about. And oh yeah, who is that? That was Spencast16. Hey doc, love your work. Thank you so much. All right, so we're gonna get into this, and then we're gonna get to some of your questions that you guys asked. Lady Nadra, hey, what's happening? All right, so here we go. Buttock augmentation. Okay, so there's a lot of myths that are out there. One is buttock augmentation is better with implants, and you know, a buttock implant kind of looks like this, right? So it's very firm, all right, and the problem, you know, when you do breast implants, that's one thing, because your breasts are kind of not, you're not really sitting on them. They're not such a functional thing. They're very important things, but not such a functional thing, right? They are important for breastfeeding. That's why we try to avoid the glandular tissue. When it comes to buttock augmentation, right, putting an implant in there can be problematic because it's firmer and it can, it's in a very dirty part of your body, right? That's like literally next to your butt. So that can lead to a possibility of infection. So high risk of infection, functional area part of your body is kind of a big problem for people that want buttock implants. It does work though. But the problem is there's a big scar typically along the gluteal crease, and a lot of times people are never really fully happy with them once they have them. They can flip, they can rotate, they can do all kinds of things that breast implants typically don't do. And in a functional part of your body, that can cause a lot of problems. So I do buttock augmentation with implants. I don't necessarily think it's better because the complication rate is high. Tends to look, it can look natural if done right, but can feel unnatural. All right, it's a functional part of the body, and and a lot of people may not like that. Okay, so I think buttock augmentation for a few select group of people works great, especially people that don't have any fat to transfer. But I don't think it's better. It's always better, in my opinion, to use fat from different parts of your body, because then we can kind of take away from fat where you don't want it, like your waist, and transfer it where you do want it, especially the buttocks. Okay, so that's myth number one. Petite or thin women cannot consider a Brazilian butt lift. Well, the answer is yes and no on that one. Almost everybody, all my patients have at least some amount of fat to work with. Okay, so some women, we have to go to the inner thigh, or we have to just do a bunch of areas to get just enough fat, 300, maybe 500 cc's to transfer the buttock area. And even then, you guys, that is still much better than using sculpture. So sometimes I do a sculpture boost, meaning that, oh, we don't have a mic for this one?
No, but yeah, I said YouTube sounds great. I have the backup here if you want.
Yeah, let's plug that in.
Sure.
I always like to have a mic. Sorry, just getting an additional microphone here for you guys. Do bulk, let's get my microphone on here so you guys can hear me better. We typically do boost it with sculpture sometimes. I wouldn't put it there. Yeah. I would put it like right here. Yeah. And the Sculptra is a stimulatory filler, and it takes a lot of products sometimes. So if we can use a combination of at least a little bit of fat and Sculptra at the same time, you can definitely do a buttock augmentation for a skinny person. Okay, but I think the best thing to do is go to a consultation with someone who does a lot of Brazilian butt lifts, who does non-surgical butt lifts. I have a whole website dedicated to non-surgical butt lifts. You can check it out on my website, drdanielbarrett.com. I have a whole procedure page based on that. So yeah, let me know if you have any questions about that. Again, by the way, if you want to check out more information about me, check out my YouTube, Dr. Barrett YouTube. I talk about a lot of these things. And then you can also check out my Instagram if you're on TikTok at Dr. Daniel Barrett. And if you're on TikTok, check out my Instagram, which is Dr. Daniel Barrett as well. Actually, my TikTok is Barrett Plastic Surgery. So you guys on Instagram, go to my main TikTok is Barrett Plastic Surgery. And for those of you on TikTok, you want to check out my Instagram where I have all my stories, some of the stuff I did today, it's Dr. Daniel Barrett, okay? All right, so we're gonna keep going here and answer 3 more myths about Brazilian butt lift, okay? Liposuction may cause loose skin. So a lot of people worry if they do Brazilian butt lift, we take the liposuction off, does it cause loose skin? And the answer is no, if done properly. Now, if you take all the fat out of an area, you can result with loose skin, especially in the front. The side, the flank, is generally extremely forgiving. So we can get about 80% of the fat out of the sides. In the front of the abdomen, I generally limit it to about to 60%. We don't want to go more than that. And then sometimes we need to, we can start tightening the abdominal area with a Renuvion or a skin tightening device like Venus Legacy afterwards, okay? By the way, guys, we go live every week, so if you want to see more footage like this, please follow me, and so that you can make sure you get all the latest updates, especially on my Instagram, okay, guys? All right, so the next one is BBL surgery will make my butt look bigger. Well, that's not a myth. That is, that's a fact, okay? So yes, your butt is going to look bigger if it's a BBL, and so a lot of, you know, again, this goes back to consultation. Some people just want to improve the hip dips. You ever see like someone who they have a little bit of a hip and then it dips? So sometimes we just do a BBL to kind of round out the buttock area. Sometimes people want it larger, and we'll do a posterior, or we'll do like a support mechanism, fat transfer. And yes, fat is part of it, but also there's structural components that sometimes can be transferred, because remember, there's adipose-derived stem cells. Whenever you do a fat transfer, you're getting those stem cells as well, all right? So those stem cells can differentiate into fibroblast cells and structural cells as well as fat. So that is a huge bonus as well, okay? All right, so last myth, gaining weight afterward will ruin Brazilian butt lifter results. So this is actually a myth that goes into liposuction as well. So people say, if I get liposuction in a particular part of my body, will that fat, if I gain weight, will it look weird, okay, afterwards? Well, the answer is not really, because imagine if you have 100 warehouses of fat in your abdomen and you take away 50 of those. When you go to gain weight, yes, you're still going to have warehouses that can kind of expand their volume, but there won't be as many, right? So you won't gain as much weight in the area that you had liposuction. You could still gain some. And if you have any contour irregularities, those contour irregularities get expanded. They get worse. So when you do fat transfer buttocks, yes, the buttock area will remember the fat memory. So if you're a person that gains weight in the abdomen and we take fat from the abdomen, and you gain weight again, your butt will get bigger. Now, a lot of people don't like that. My recommendation is be at your goal weight when it comes time to the surgery, and then stay at your goal weight. If you do gain weight, you're going to exaggerate the results, because your buttock is going to get more big than the other area that we took the fat from. And you may like that. That may be a good thing. But it doesn't make you like have fat in weird places of your body or anything excessive. Generally, it's actually a positive thing, because where we do liposuction is where you have a problematic area and you don't want the fat to be there in the first place. Okay. Let's see.
So we have some questions.
I'm trying to change my filter. You put a filter on my TikTok here. Anyway, what?
Did I?
I think you did. Anyway, is that a filter? Whatever. Okay. I have a beauty filter on. Okay. So, all right. So, natural ways to get your breasts, I guess, your breasts bigger. So let's jump it. Or do you have some other questions?
Yeah, we have some questions. Breast augmentation is dangerous.
Okay, well, I think we're talking about BBLs. So,
Yeah,
okay. So any question you guys about BBLs right now, before I move on to some of the breast myths, I want to make sure that I answer any questions that you guys have. I'm going to wave to a couple of you guys. What's up? Okay. All right. Questions about Brazilian butt lifts. It's a very dangerous procedure, okay? It has the highest death rate, 1 in 3,000, but that is generally because there's a lot of people doing this that are not even doctors, okay? So those statistics are kind of nationwide, and they're not board certified plastic surgeon specific, okay? We have specific ways, protocols in which we do BBL, so we avoid that fat embolism, okay? How long will it take, this is from Desirina Letele, how long will it take for it to become soft? It generally takes about 6 weeks for it to start to be soft. Can you reverse, this is from Tracy, can you reverse a BBL? Yes, you can. Sometimes we have to do some tightening with that as well. And Orvester sleeve life, yes. Do you provide 2-round procedures? Yes, I do. That is a very common thing. Sometimes we'll do 1 round with just abdomen and flanks, and then we'll go back and we'll do a 2nd round with the inner thighs or arms. and so forth. Yes, Tracy, I can reverse a BBL. Shoot, you guys, if you're actually interested about yourself, check out my virtual consultation page. That's at my website, drdanielbarrett.com, virtual consultation. Fill out the information. It'll come to us. We'll take a look at everything and see if there's anything we can do. If you exercise your glutes after a BBL, will you lose fat in that area? Alejandro, that is a myth. That's a great myth that you just brought up. No, exercise actually boosts your results, brings in blood flow. A lot of people think that, oh, you're going to burn it off, but it's not. That's not the case. All right, recovery time for brachioplasty, that's a different subject, but it's about 2 to 3 weeks, depending on what we need to do. Okay, and then I think that's all your questions about BBL, guys. And we're gonna move on to breast myths. Okay, ways that you could get, so much stuff out there on TikTok and Instagram is like, how to get my breast bigger. And one of them is olive oil, rubbing olive oil on your breast, and that makes sagging breasts firmer or bigger. And there's no studies on this, and I've not seen it work, and I haven't tried it, but it doesn't make sense to me that olive oil on your breasts should actually make them bigger or firmer. Okay, so that to me is a myth. I'm gonna knock that one off. Don't put olive oil on your breasts, put it on your salad, it'd be better for you. Although make sure it's organic and cold pressed, and don't cook with olive oil. You guys know that, right? Cook a little bit, like low heat, but as soon as you get to high heat with olive oil, you're creating a rancid, oxidized oil. It can't withstand heat, and then it actually creates an inflammatory process in your body. So if you're going to cook at high heat, use avocado oil, but the problem is most avocado oil is not actually avocado oil. So my recommendation is beef tallow or butter to cook at high heat with. You're gonna get better results with that. Okay, so we got off topic. All right, so crunches, trim the belly fat, strengthen ab muscles. Once ab get in shape and toned, it strengthens breast muscles and you get fuller breasts. Well, I believe in core muscle working, and believe it or not, in some people there's an extension of your abdominal muscle into the breast area. So I don't think that's a myth. I think that actually could be quite true, because if you slim down here and you have a tighter core, you're gonna have better posture and your breasts are going to look bigger. And some people have a little bit of that muscle extending into the breast tissue, so that is great. Although now if you lose weight, typically if you lose weight as a woman, your breasts will tend to get smaller, okay? So if you lose weight along with that abdominal process, your breasts might actually get smaller as well, okay? So what else? Taking birth control will oftentimes make your breasts bigger. That's not a myth, okay? So if you're wondering if you take, but I don't recommend taking birth control. I understand if you don't want to get pregnant, you got to do what you got to do. But the progesterone in there is a synthetic progesterone. There's a lot of risks that happen when you take birth control. I don't recommend it, and they don't tell you about all these psychotic things that can happen when you take birth control. If you've ever been on birth control, you kind of know what I'm talking about. But the progesterone that goes into your brain is different than natural progesterone, and it causes anxiety and depression in the majority of women, and people don't talk about that. Okay, so but yes, it does make your breast bigger. Getting pregnant makes your breast bigger. No brainer there. Breastfeeding makes your breast bigger. There's some women that have a tumor, and even men that can have a tumor. It's called a prolactinoma. That actually can grow next to your pituitary, and what it does is it secretes prolactin, which is the hormone that causes breast growth. And so if your breasts are all of a sudden getting bigger, irrespective of the breast of your body, your body's normal, and all of a sudden your breasts start to get bigger, and you're a full-grown woman, and they start lactating, you may want to get checked out to make sure you don't have a prolactinoma. That's a tumor that you may want to get removed, okay? IUDs typically don't cause breast growth unless they have they secrete a lot of progesterone, Elgar, okay? IUDs, I do think they're probably a little bit better than birth control, but it depends on the type of IUD. They do release a lot of hormones into the body most of the time for IUDs, with exception, I think, copper IUDs. But talk to your OB-GYN about that, okay? All right, milk, vegetables, soy. Okay, intake of milk contributes to the growth of breast tissue. It could, potentially. You guys, cow's milk, depending on what you get, is filled with a lot of growth hormones, a lot of antibiotics. Do you guys know why they give cows antibiotics? Does anybody know why they give cows antibiotics? For majority of the beef that you eat is filled with antibiotics, okay? Unless it's grass-fed, no antibiotics listed. Does anybody know why they just pump cows full of antibiotics? I'm gonna wait. Anybody tell me? It's not to prevent infection, okay? It actually, what's funny is that when you give cows, and nobody knows this, okay? When you give cows antibiotics, their gut bacteria decreases. and it causes them to gain weight. And they know that. And so farmers know this. Not to keep it pink. No, that's different. Okay, to grow faster, yes, sort of. So they don't have to take proper care of them, sort of, Stefan, but it's not to prevent bacteria. What it does is it kills the bacteria in the gut. And when you have, when they do that, the cows put on a ton of weight. Same thing happens to humans. If you take antibiotics on a regular basis, your gut diversity goes down, your weight goes up. Obesity is directly correlated to the diversity of the bacteria in your gut. This has all been shown in studies, guys. So that's why they give cows antibiotics almost, unless it says no antibiotics on it, or organic, or grass-fed, without antibiotics, it is guaranteed that there's going to be antibiotics in the meat that you're eating. Guess what? When you eat that, your body is getting the antibiotics too. Okay, same with all the growth hormones and whatever else they're doing. So it pays to pay attention to the food that you're eating. But it will potentially make your breast bigger, but not in a healthy way. So I don't recommend that. Soy, there have been some studies which soy actually increases breast size, and also in particular male breast growth. Okay, because that increases some of the female sex hormones, progesterone and estrogen. Okay, but I don't have a lot of data on female breast growth. That's mostly for male breast growth. Estrella Rohama, my dad have organic cows. Let me know. I will come out and buy one of your organic cows, Estrella. Where are you located? I like organic cows. I like cows. I actually like bison, because bison is really hard as a big pain in the ass to actually factory farm bison. So if you really want good meat, get bison meat. It's what our ancestors, it's the closest thing to our ancestors actually hunted and killed. Cows have been domesticated, and who knows what kind of genetic abnormalities they've developed over the time. Yes, Carolina, cortisone can cause weight gain as well. And cortisol is your natural body's hormone, right? So if you have a lot of stress, you can gain weight. All right, but we're talking about that. And then there's also PCOS, which is based on, anybody have PCOS, Polycystic Ovarian Syndrome? That is an excess production of estrogen in your bodies. It mainly comes from over insulin production because you're eating too much sugar. Nobody tells you that. They put you on a bunch of like methotrexate and all this other crap, right, to suppress your immune system and everything else. It's based on your diet. PCOS is a diet-induced illness. If you think you have PCOS in the world, you've had bad cards, it's not. It's because of your diet, and you can change it. All right. Once you have it, it's harder to get rid of, but that's what's going on there. Okay. Smoking. Does smoking affect breast size? Generally, smoking does a lot of bad things to you. It typically does not make your breast bigger. If anything, it makes you kind of look smaller, like a crackhead. So smoking kind of stresses you out with all the nicotine and all the tobacco smoke. It's just really bad stuff. Nicotine by itself, believe it or not, it's not so bad. Okay, but it's all the tar and all the smoke that's really the bad thing. So, but again, most of the time nicotine is really kind of bad. It's bad, especially around surgery. I don't operate on people that are smokers because it causes a lot of wound healing problems. It prevents angiogenesis, prevents that new blood supply to certain areas. So smoking's bad. It's kind of funny. I forgot how many people smoke until I traveled to Europe. And everybody over Europe is like smoking like crazy. And then there's a lot less people here, especially in Los Angeles, that smoke. I mean, I still go to New York and I still see people outside smoking all the time because they're such addicts over there in New York. There's so much energy. But anyway, out here a lot of people don't smoke, which I think is good anyway. How do I get rid of a keloid, Musasi? Probably typically if it's a real keloid, you have to cut it out, close it, put some steroids in it when we do it. Okay. All right. Any more myths that we have? I think that's it, you guys, about breasts. If you want to make your buttocks look bigger naturally, I suggest there's a lot of gym workouts that you can do. I'm actually going to do a YouTube video about this so that you guys can learn about that. Can we turn that temperature down, please? Yep. It's not working. Oh yeah, hit that home button. Here we go. You're good. Okay, so you guys check out. All right, again, thanks for watching. Check out YouTube, Dr. Barrett Plastic Surgery, and then also my Instagram, Dr. Daniel Barrett. We are having a lot of influx of surgery patients right now. If you're interested in getting BBL, please give us a call, 310-598-2648. We got people here in the office right now that can take your phone call. I'd love to get you in and meet you, or if you want to, just fill out our virtual consultation page at Dr. Daniel Barrett. If you are getting surgery somewhere else and you want still some of the stuff that we would kind of recommend, you can check out my website, postoprecovery.com. I have a lot of post-op products that can help kind of optimize you. There's a lot of bad things that happen with the antibiotics. And I do still use antibiotics for my surgeries, but I try to optimize my patients so that afterwards our patients tend to heal faster. Yes, we're out hiring, we do need nurses, we do need everybody else. So if you're interested in working for us, great. Give us an email at careers@barrettplasticsurgery.com. Send us your resume, careers@barrettplasticsurgery.com. Okay, guys, thank you for watching, and I hope to see you guys soon. Thanks for watching and follow. Make sure you follow over here.